The Department of Health has assured the nation that the initial 500,000 doses of the COVID-19 vaccine will arrive in the country by the end of the month. Healthcare workers will be the first to receive the jabs. Essential workers will subsequently be inoculated, and then citizens will join the queue. The Health Department Director General, Dr. Sandile Buthelezi, says the money has already been paid to the Serum Institute in India.
We've got it in writing. We've done our payment to Serum Institute, and we've been told that as soon as it reflects on their account, which will probably be within a day or two, since an international payment, they will do the shipment, which will take about 5 days. So before the end of this month, the first batch of the drugs, according to the discussions that we've had and is in writing, will be at OR Tambo International Airport. The first phase, we have actually targeted that we should be able to do it within 3 months, even finishing before that, but we've given ourselves 3 months to be able to finish vaccinating the healthcare workers, both in the public and private healthcare sectors, using multiple platforms that we've put in for us to be able to reach as many people as possible.
For a reaction on this, I'm joined now by Sibongiseni Delihlazo, the DENOSA Spokesperson. A very good afternoon to you, and thank you so much for your time. What is your reaction to the plans that are currently in place for the rollout of vaccinations to healthcare workers?
Well, good afternoon to you, Thami, and to the viewers at home. Well, as DENOSA, we do welcome the commitment by government, in particular, to prioritize healthcare workers in the first phase of the vaccination rollout. You would remember that healthcare workers have been hardest hit by the pandemic themselves. And in the country, we've got no less than 430 healthcare workers who have succumbed to the virus in the line of duty. And worldwide, nurses themselves alone, we have lost 2,262 nurses in 59 countries. And 1.6 million healthcare workers have been infected. We therefore welcome this because it gives an opportunity to many of our healthcare workers, particularly those with comorbidities, because in this country, there's a shortage of healthcare workers. And sometimes healthcare workers with comorbidities sometimes are forced to work in COVID-19 units and against their will. Some have left us, unfortunately, leaving behind their children who are now orphaned and with no certainty for their future. So therefore, we do welcome this opportunity for those who would wish to take it up. However, we do understand that there are pretty much doubts out there and some various theories that are doing the rounds on our social media networks. And we wish the department could pay special attention to such, because it's important that a message is very clear and transparent from now onwards, and in particular towards healthcare workers. Because there are healthcare workers, of course, who are...
Sorry about Delihlazo. I was wondering, what is the morale at the moment as far as nurses are concerned? I mean, just earlier on, we heard reports of a number of nurses who have passed away.
Well, the morale is quite very down. You'd remember that these are colleagues of nurses who are on the front line, and those who have died have been with them on the front line. And therefore, they are very depressed. And also, there's a shortage of nurses in this country. In fact, there's a shortage of healthcare workers. And to lose your healthcare workers on the line of duty, and you are not going to be as confident as you were before. And the issue of safety of healthcare workers is of paramount importance. Therefore, the morale is quite low, and we wish that the department could cascade as much information on the ground to ensure that those with questions must be clarified. In fact, it is very important at this stage that the department goes out there to communities, in particular to nurses, because nurses, where they have questions, it's because they need to be informed, because they are the drivers of this program. They need to be able to answer to communities, because people must consent before they get vaccinated, and they will be asking questions of nurses. Therefore, it is important that as much questions that people are having on the ground, healthcare workers must be capacitated to be able to deal with such issues. But also it is important because this is the biggest program and everybody must be on board. And it is quite important because we've lost so many people, including healthcare workers themselves, that an opportunity of this nature, if, for instance, doubts are making rounds on social networks, some people may choose not to take it, and that will be putting their lives on the line. Therefore, every important information must be cascaded down to healthcare workers. That way, you'll be empowering them to be able to empower communities.
And what is the situation regarding PPE, in as much as some hospitals have got enough stock or enough supply? We've also been hearing that that is not necessarily always making its way through to the nurses and the healthcare workers. What has been your experience?
Well, unfortunately, the management of supply of PPE from the depots to institutions sometimes needs a lot to be desired. And there's a need, obviously, for management to ensure that they up their game, to ensure that PPE gets to facilities timeously. But you'd also remember that previously we've had some concerns over the issue of quality of PPE, because we had instances where healthcare workers were given PPE and yet they got infected in large numbers. And our question from where we are as a representative organization for nurses has been, is the quality of this PPE up to standard? And it has been an issue, and we're quite happy with UCT when they did a study on the quality of various brands of KN95 facial masks, in which they found, when they tested about 12 different brands, and they found the efficacy and filtration integrity of many masks to be questionable. And we hope that the department is making means to ensure that those PPE which have not yet gone through the safety and quality standards, they must not find their way in our healthcare facilities, because it would not be nice to assure healthcare workers that there is PPE, and sometimes, because we do normally get complaints from our members where they would get facial masks clearly returned, not for medical use, and yet they would be given to nurses who are on the front line. And that is very, very much concerning to us.
Certainly matters that ought to be addressed and of great concern there. That's a DENOSA spokesperson, Sibongiseni Delihlazo.